Welcome everyone, and thanks for joining to help us kickstart Healthy and Safe Swimming Week. We are live for the next 15 to 20 minutes to answer your questions. I'm Brittany Boehm, your moderator for today, and I'm joined by CDC expert Michelle Hlafsa. She is chief of our Healthy Swimming program here at CDC. Last week, CDC released new data that showed mixed progress in preventing outbreaks linked to pools, hot tubs, and water playgrounds. Today, we're going to talk about some of these findings and also provide tips to avoid getting sick from swimming this summer. Michelle, can you first tell us about some of the key findings from this report?
So big picture, there were almost 500 outbreaks linked to pools, hot tubs or spas, or water playgrounds that were reported to CDC for the years 2000 to 2014. When we looked at outbreaks by individual causes, we saw some outbreaks went up in numbers over the years, some went down, and some stabilized or stayed level.
So what were some of the germs that were causing illness?
Well, the top three causes were germs. There's Cryptosporidium, a parasite that causes diarrhea. There's Legionella, the bacteria that can cause a severe pneumonia known as Legionnaire's disease. And the Pseudomonas, the bacteria that causes skin infections or a rash, and outer ear infection, commonly known as swimmer's ear.
So how do people get those germs from the pool?
So there are different ways to get these germs when swimming in a pool. For example, Cryptosporidium, you get when someone who's infected with crypto for short, going into the pool, having diarrhea in the pool, and then other swimmers, unfortunately, drinking that contaminated water.
What about those other bacteria?
So for Legionella, it's about inhaling vapors or mists or aerosols that contain the bacterium. For Pseudomonas, it's about your skin coming in contact with contaminated water. What we see oftentimes with hot tub rash is the rash will look like the shape of the bathing suit because the bathing suit is holding the contaminated water against the skin. With swimmer's ear, it's just water being, staying in the ear.
Right. Are some people more likely to get these type of diseases than other people?
So young children who haven't been exposed to certain germs before, pregnant women who have an altered immune system, and older people who have an aging immune system, once they get infected, might have more severe symptoms. People with a weakened immune system, if they get crypto, they could have life-threatening symptoms.
Oh, man.
And people who are 50 years of age or older, people who are cancer patients, people who have chronic diseases, particularly chronic lung diseases, or people who have a weakened immune system, they're more likely to get sick when infected with Legionella.
So does chlorine not kill these types of germs in the pool?
Well, at levels that CDC recommends, at levels that most state and local health departments recommend, most germs are killed within minutes. Crypto is a big exception to this. Crypto can survive 4 days in a well-maintained pool.
Wow, what about the other ones?
In and of themselves, Legionella and Pseudomonas are killed within minutes with chlorine, just like most germs. But Legionella and Pseudomonas are really good about creating a biofilm around themselves, or a slimy layer that protects them for chlorine. So if the chlorine level drops, they build this biofilm, they grow on surfaces, and then when the chlorine level comes back up, they're protected from the chlorine.
Is there any way for us to know whether there's biofilm in a pool?
Well, the best way to check it out is to check the wall of the hot tub or the spa where the top of the water meets the wall. If it's slimy, there's a biofilm there, and the pool hasn't, or the hot tub has not been cleaned or scrubbed recently enough.
Gross. I know my family and I are probably going to go swimming a lot this summer. Are there some benefits of swimming that you can talk about?
Well, you just mentioned one. It's a great way to have fun with family and friends. But there's also the opportunity to get some physical activity in. We recommend 2.5 hours at least of physical activity a week, and why not make it water-based and fun?
So let's get practical. What is something we should all be doing before we get into the water?
Before you get into the water, you can, before you even consider getting in the water, don't swim or get into the water, or don't let your kids swim if sick with diarrhea. We don't want to share that with anyone. Check your inspection score before going to a public pool or hot tub or water playground. By public pool, I mean a pool that's not in someone's backyard, where multiple families would go, kind of at a hotel or a water park, or your town pool. Your state or local health department might post the inspection results. on their website, or might require the pool or hot tub to post it at the water side. We check inspection scores before we go out to eat. We should be checking inspection scores before we jump in the water.
Right. What about those little test strips that you can find some places?
Well, that's another step you can do before you get in. Do your own mini inspection. And you take the test strips and you check the chlorine or bromine level before you get in, and the pH. The pH is going to be important because it's going to determine how effective the chlorine or bromine are at killing germs in the water.
Where can you get those strips?
You can go to a pool supply store, a hardware store, a big box store. About 100 of them go for $10.
Interesting.
And, oh, sorry?
Go ahead.
Oh, and I was just going to add to let everyone know what you can do is you dip the strip in the water and then compare the colors on the pads of the strip to the colors on the bottle, and depending upon where the color is, that's what chlorine level or bromine level you have, and that's the pH you have in the water.
Interesting. Seems easy. What about once we're in the pool, in the water? What do we do?
Well, once you're in the water, don't swallow the water you're swimming in. If we have to tell people not to swim with diarrhea, we shouldn't be drinking the water. And as far as parents of young swimmers, they should remember not to put toys in the water that encourage drinking that water. Also, they should be taking their children on bathroom breaks every hour. And if they have a little one that's still in diapers, check that diaper every 30 to 60 minutes and change the diaper away from the water.
Good advice. I have a 5-year-old daughter, and we're going to be doing water playgrounds this summer. Is there any specific advice for water playgrounds?
The most important piece of advice specific to water playgrounds is don't sit on the jets. That is recycled water in many water playgrounds. So what we're basically doing when we sit on jets is we're rinsing off our bottoms, we're rinsing out that diaper, and then sharing that water. So stay off the jets.
Ooh, okay, good advice. So we're going to take some questions live from Facebook right now. Be sure to ask a question online. Our first question comes from Louise. I swim year-round in a public pool. I wear goggles. What other personal protective equipment is there?
I think the most important thing you can do is to do your own inspection before getting in the water, using those pool test strips to make sure the chlorine is where it needs to be, or bromine, and make sure the pH is where it needs to be. That's the most important step you can take before getting in.
Okay, great. And another question from Mary, do we have any recommendation on the best type of test strips to use?
My #1 recommendation with test strips is to follow the manufacturer's directions. Make sure that you hold the test strip the way you're supposed to.
Okay, got it. And we have another one that asks about clothes or bracelets that change color or indicate somehow that the water has been contaminated. Do we have any technology that, do we know of anything like that that has clothing or bracelets that change color based on water contamination?
I wish we did.
Yeah.
But unfortunately, no. I mean, even there's that urban legend that there's a special chemical in the pool that changes color when someone pees in the pool. Unfortunately, that doesn't exist.
Gotcha. Okay. What about like free-living amoeba? Is that ever an issue in swimming pools?
Naegleria fowleri, which is commonly known as a brain-eating amoeba, should not be an issue in a well-maintained pool.
Okay, great. And what about, this is something I always think about, the red eye we get in the pool. What's that from?
A lot of people think that's chlorine, but actually that's chlorine mixed with what we swimmers bring into the water. So if we pee in the water, if we don't shower before we get in the water, we bring stuff into the pool that mixes with chlorine, forms an irritant, and that's actually what's making our eyes red, not the chlorine in and of itself.
Oh, interesting. We have a question from Andrea Nicole. Is it worthwhile to use a test strip in a spray park?
Definitely. Spray parks are where the jets are shooting water up out of the concrete, basically. And when you shoot that water up, you're introducing air into the water, and you're depleting the chlorine or the bromine in the water. So it's harder to maintain the disinfectant level in the water. So I would be especially careful to check the water in there. That, and you also have little kids in the water, and those kids are, bringing their germs into the water, and they're drinking the water. So.
Well, speaking of kids, what do you think about swim diapers? Do they work to prevent some of this illness?
Not exactly. Germs can be slowed down in terms of what swim diapers are able to do. They're able to contain solid poop, within the diaper for a set amount of time.
Right.
But when they've conducted studies looking at swim diapers, within minutes, germs are getting out of those swim diapers. If water's getting in, it's getting out, unfortunately.
Right. Well, what about pee? Is pee just as bad as poop in the water?
Pee brings its own problems, different problems into the pool. So I mentioned earlier, when pee mixes with chlorine, it forms an irritant and makes your eyes red. What it's also doing is that it's using up the chlorine that would otherwise kill germs.
Gotcha. Okay. What about if there's like leaves and bugs in the pool? Does that mean that it's not a well-maintained pool, and should we be concerned about that?
My concern with stuff in the water like leaves and bugs would be that the chlorine is being used up. The chlorine is interacting with the leaves and with the bugs, and there's less chlorine to kill germs in the pool.
Right. We have a question from Louise about parts per million of chlorine in pools. What's the safe level for chlorine?
So we at CDC recommend at least 1 part per million of free available chlorine in water, and that's the form of the chlorine that kills germs. And we recommend that for pools and for water playgrounds. For hot tubs, we recommend at least 3 parts per million.
Gotcha. Thanks. So what is CDC doing in general to help prevent some of these water-related outbreaks?
So what we've done is we've done studies looking at how we kill cryptosporidium. If the levels that we normally keep chlorine at aren't working, how are we going to prevent crypto from spreading and causing infections and outbreaks? And so we did a study to look at how best to kill crypto, and we found that raising the chlorine level to a much higher level for a really long period of time when there's no swimmers in the water is the best way to deal with it once it's in the water. But of course, the main message is don't swim with diarrhea. Keep it out of the water in the first place.
Gotcha. I know we're talking about disease today, but what about drowning and other injuries? Are there things we should be on the lookout at the pool for preventing drowning?
The best way to prevent drowning is to learn how to swim. And if you're a parent of a young swimmer, stay close to the young swimmer and pay close attention to that young swimmer. Put that phone down. The smartphone can wait till later, the texting and all that, because people drown, and they drown quietly and quickly. Right. What about athlete's foot? Is that ever a problem in pools? With athlete's foot, I'd be more worried about keeping the flip-flops on in the locker room and while showering.
Got it. How about, are there any tips to not be distracted around the pool?
Like if you're watching
little
kids,
ones, yeah.
Oh, put that smartphone down. I think that's the #1 way. Make sure you're paying close attention to your little one and you're close by.
Gotcha. We have another question from Alexander. Do you know how dirty our local ocean beach is? So any way to determine if your beach is has dirty contaminants in it?
So our ocean beaches should be monitored for their water quality, and some beaches have chosen to post their scores online, much like we post inspections online. If there is something wrong with the water quality, there should be a sign posted on the beach saying, the beach is closed to swimmers due to water quality, or something to that extent.
Gotcha. Are there any policies about, laws or ordinances and where places where people have to shower before going into the pool? Like, are they required to do so, or is it just a recommendation?
It depends on what your community requires. Some communities require signs to be posted. I know at my gym, there's a big sign before you exit the door to the pool area saying you need to shower, and the lifeguards actually send you back into the locker room if you're not wet.
Interesting. Okay. Well, I think we are about done for today. Michelle, I really appreciate you being here. Is there anything else you'd like to tell everyone?
I encourage everyone to go swimming this year, and especially this summer, but just do it in a healthier and safer way.
Thank you so much. Well, thank you all for joining us today and for your great questions. If we didn't get to any of your questions, we'll respond as soon as possible today. Have a healthy and safe summer, everyone.
Hello, I'm Dr. John Iskander. Welcome to CDC Beyond the Data. I'm here today with Dr. Catherine Fleming-Dutra, Deputy Director of CDC's Office of Antibiotic Stewardship. So, Catherine, we heard at today's public health grand rounds about some of the issues around antibiotic use and antibiotic resistance. Let's start with a working definition of what antibiotic stewardship is.
So antibiotic stewardship is the effort to measure and then improve antibiotic use so that antibiotics are only used when needed, and when needed they're used correctly, meaning the right drug at the right dose for the right duration.
So that's a great start. I think a lot of our audience certainly has heard and has been hearing for a while about issues around antibiotic resistance. What is the main driver of that, and how big has the problem become?
So antibiotic use is a major driver of antibiotic resistance. But it's the major modifiable driver of antibiotic resistance as well. Antibiotic resistance is a very important public health problem. CDC estimates that 2 million illnesses and 23,000 deaths a year are caused in the United States by antibiotic-resistant infections. And it's really important to remember that antibiotics are really important to modern medicine. They allow us to do surgeries, treat cancer, to prevent and treat bacterial infections in many of our vulnerable patients. So having effective antibiotics is really important for modern medicine as well.
And another thing that was featured in the session was that it's not only that inappropriate antibiotic use drives antibiotic-resistant bacteria. There are other harms as well. What are some of those?
That's a great question. So we talk a lot about antibiotic resistance, but many patients don't really realize that there are other harms. So as with any medication, antibiotics also have side effects and adverse events that can be caused by antibiotics. One of the most important ones, or one of the ones that CDC works quite a lot on preventing, is something called Clostridium difficile infection, or C. difficile infection. It's caused by antibiotic use. C. difficile is actually a bacteria that can overgrow when someone uses antibiotics and cause a very serious infection. And additionally, antibiotic resistance, as we talked about, it's an issue both at the population level and for that individual who takes antibiotics. They can be at risk in the future for antibiotic-resistant infections as well.
So one of the most striking numbers that I'll retain from this session is the proportion of antibiotic use that we scientifically study to be inappropriate. What is that, and can you give us a little context on that number?
Right, so CDC estimates that at least 30% of antibiotics prescribed in the outpatient setting in the United States, particularly in doctors' offices and emergency departments, are unnecessary, meaning that no antibiotic was needed at all. And so, for example, many antibiotics are prescribed for things like common colds, which are caused by viruses, for which antibiotics don't help the patient, but yet can put the patient at risk for these adverse events and harms, including C. difficile infection and antibiotic-resistant infections. We estimated that number comparing the antibiotics that are prescribed for the diagnosis for which they're prescribed, and comparing those to national clinical practice recommendations from health professional societies about when antibiotics are needed for particular infections.
So yeah, I think a lot of our audience probably this is not news to them that antibiotics are not indicated for uncomplicated colds. But there are a number of other diagnoses, common diagnoses, for which antibiotics may either almost never be indicated or that there may be alternatives to antibiotics. What are some of those other common conditions?
It's a great question. So, for example, I'm a pediatrician, and so one of the common infections that pediatricians see is acute otitis media, or middle ear infections. Antibiotics are sometimes needed to treat middle ear infections, but they're also the clinical practice guidelines also recommend a strategy called watchful waiting, in which you wait a few days for mild ear infections to see if the child gets better before deciding whether or not they need antibiotics. Additionally, in adults, sinusitis is a very common infection, or sinus infections, but that's another another infection in which professional guide or national clinical practice guidelines from professional societies, some of them recommend watchful waiting before deciding whether antibiotics are needed, because many patients will get better without antibiotics.
So you mentioned being a pediatrician. That's a background we both share. And one of the interesting aspects of the data presented in this session was that in pediatrics, we actually have made a little progress in how we use antibiotics. Tell us a little about that, and what are the lessons for our colleagues who provide primary care for adults?
So, thank you. So we have seen in the last several years, from 2011 to 2015, that overall outpatient antibiotic use among children in the United States has been decreasing. And there's probably many reasons for that. One very important lesson that we can learn from that progress is that vaccines are a good stewardship, antibiotic stewardship tool. So for example, the pneumococcal conjugate vaccine, which was introduced in the US for children in 2000, the 7-valent, and then it was an expanded valent introduced in 2010. That vaccine has been very effective, has reduced pneumococcal infections, and one of the most common pneumococcal infections is acute otitis media or middle ear infections. So reducing disease has led to less need for antibiotics to be used in the population. And additionally, pneumococcal conjugate vaccine has also directly targeted resistant pneumococcal infections. And so that has also allowed us to move to using more narrow spectrum antibiotics for these common infections. So getting at the improving antibiotic selection and not having to use our broader spectrum antibiotics as well. Another lesson learned is that there has been a lot of collaboration between professional societies from pediatricians and pediatric infectious diseases doctors, for example, and CDC and public health to work on improving antibiotic prescribing to children. And CDC has actually had efforts to improve antibiotic prescribing among children for many years, since the mid-1990s.
Yes, I certainly, in my early days in public health, was involved with some of those efforts at a state level. So certainly we can then use some of those same vaccines more and better in adults, and we can work with professional societies that are involved in adult medicine. So we heard from Dr. Jeff Linder today about some different types of approaches to changing prescribing behavior. A lot of which draw on insights from behavioral economics. What are some of those interventions, and how do those work?
Yes, so one of the things that we have learned over many years is that while education about appropriate antibiotic use is of course important, patients and physicians and clinicians need to know when to use antibiotics appropriately. It's not enough to change behavior in antibiotic prescribing practices. So some of the interventions that were talked about today help nudge clinicians or move clinicians in the right direction to help make the right antibiotic prescribing decision easier or for them to do. So for example, they talked about a commitment poster in which the clinician has basically written a letter to their patients committing to use antibiotics appropriately only when they provide more benefit to the patient than cause harm. And that poster is then displayed in the examination room so that the clinician sees a reminder of their commitment to their patient at the time of the exam. And that has been shown to improve antibiotic prescribing, reduce antibiotic prescribing for conditions for which they're not needed. And that's really a nudge. So the clinician still has the freedom to prescribe antibiotics when they need to, but it reminds them to do it in a way that's concordant with guidelines. Another intervention that we talked about today was peer comparisons. So where the physician or clinician gets an email that tells them how they're performing compared to their top performing peers who are prescribing antibiotics in concordance with guidelines for certain conditions. And that's also been shown to be effective.
Yeah, I remember asking Dr. Linder about what is, how do clinicians react when they see something that says you are not a top performer? Don't they get upset? And his answer was, that's part of how it works, by engaging emotions, because again, as you said, simply providing the facts by itself hasn't really moved the needle in appropriate prescribing very much. So let's come back to the bigger picture doctors and other prescribers are working in clinics, in hospitals, in these larger institutions, what are some of the policy innovations or levers that can be used to, on a population level, help better use antibiotics?
So CDC has actually put together a series of core elements of antibiotic stewardship across the spectrum of healthcare. We have one for hospitals, for nursing homes, as well as for the outpatient setting. And while those documents are from CDC, so they're really a framework. They provide a framework of how antibiotic stewardship can be implemented within these healthcare settings. And then other partners, such as the Center for Medicare and Medicaid Services, or CMS, have then taken the core elements from CDC and are using or recommending those, or sometimes even requiring those as part of increase implementation and uptake of the core elements. Another example is the Joint Commission, which is an accrediting organization for healthcare facilities, has having an antibiotic stewardship program, at least for hospitals, in their accreditation standards, and that has also increased the uptake of the core elements of antibiotic stewardship.
So we have a very interesting array of interventions at the policy, at the practice, and at the individual provider level. Are there upcoming events or observances, or are there things about campaigns to promote appropriate antibiotic use that you'd like our audience to know about?
Yes. So CDC has an educational effort now called the Be Antibiotics Aware Smart Use Best Care educational effort. And it's the mission of that effort is to educate both the general public and healthcare professionals about appropriate antibiotic use in effort to combat antibiotic resistance and to improve patient safety. And we have ongoing, we have lots of tools and resources available on our website for Be Antibiotics Aware that clinicians and patients can use. Additionally, CDC has a national the U.S. Antibiotic Awareness Week observance that happens every year in November. This year it'll be November 12th through the 18th. And that actually it coincides with World Antibiotics Awareness Week and observances in multiple other countries around the world. And that's a time in which we really try to raise awareness about appropriate antibiotic use, combating antibiotic resistance as well.
So I think that's a good note to end on. Reminding ourselves that appropriate antibiotic use is part of both healthcare quality and protecting patient safety. Thank you very much, Dr. Fleming-Dutra.
Thank you.
Please join us next month for CDC Beyond the Data.